Hi, so I'm Ron Cohen. I'm the chief of the section of adult and pediatric endocrinology, diabetes, and metabolism. I'd like to just discuss a little bit about this section today. So first, this is a group of pictures of our faculty. We have faculty with a wide variety of interests ranging from diabetes to thyroid disorders to hypertension, adrenal, pituitary, PCOS, really all the usual suspects, as it were, in endocrinology. And we have people who have interest and expertise in all of them. I'd like to first just really discuss the objectives, the training objectives of our fellowship program. We wish to provide rigorous training for endocrinology fellows to become experts in the diagnosis and management of the full spectrum of endocrinology disorders. We want to provide an environment that supports scientific inquiry and allows fellows with that interest to develop into successful clinical and/or basic science investigators. And we want to support the development of our fellows into physician leaders who will excel in the broad array of career opportunities in and outside of academia, including advancing population health and care of underserved communities. Really, we want to be here to help you progressing your career, learn endocrinology, and be in a position to do whatever it is that you want to do with that training. And one of the special features about our section is that we are a combined section. We include both adult and pediatric endocrinologists. We work together. We're in the same clinic. We have an overall unified educational program, and most of our conferences are combined, including the didactic endocrinology lecture series for the fellows, our clinical case conferences, which for one reason or another we call Endorama here at the University of Chicago, and our Monday research seminar series. And importantly, many research groups include both adult and pediatric endocrinologists and adult and pediatric endocrinology fellows as part of their groups. So I'd like to discuss a little bit about the research opportunities here. And this I just show that we do research in a broad array of endocrinology topics, ranging from diabetes and obesity to sleep, hypertension, polycystic ovary syndrome, metabolic bone disease, and thyroid problems. So I'd like to start with diabetes. We are a national center for the study of monogenic and atypical forms of diabetes. And the people on the right side of the slide are some of the leaders in these efforts, including Graham Bell and Lou Phillipson, Siri Greeley, and Rochelle Naylor. And this just actually shows, in a sense, in a nutshell, about how we are a combined section. Graham Bell and Lou Phillipson have their primary appointments in the Department of Medicine, and Siri Greeley and Rochelle Naylor have their primary appointments in the Department of Pediatrics, but all are members of our section of endocrinology. And they are, again, one of the leaders in this field, and they have a registry of patients with monogenic diabetes that they can then target to study with either clinical studies and or more basic science experiments. In fact, most cases of diabetes under 6 months of age are due to monogenic causes. KCNJ11, ABCC8 are common causes under 6 months. In many cases, can actually be treated with sulfonylureas instead of with insulin. However, when neonatal diabetes is diagnosed between 6 and 12 months of age, autoimmune diabetes starts to become more likely. And our group here is at the forefront of understanding many, many different forms of monogenic and also other atypical forms of diabetes. In fact, we are one of a handful of institutions that has an NIH-funded diabetes research center. The PI on this center is Graham Bell, who's an internationally known expert in the genetics of diabetes. It contains multiple cores. In addition to the usual administrative core, there's a genetics/genomics core, a cell biology core, a physiology core, and a pilot and feasibility program for people who are interested in getting a relatively modest amount of money to start projects in diabetes and diabetes-related fields. We also have a very strong group in thyroid disease. And I like this slide. Oh, the people on the left here, this includes Dr. Repetov, Dr. Bianco, and Dr. Dumitrescu. I like this slide. This really shows I'm interested in thyroid disorders clinically, and this shows the regulation and action of thyroid hormone. As everybody knows, This all starts in the hypothalamus, where hypothalamic neurons secrete TRH. TRH is released into this portal circulation that goes directly to the anterior pituitary, which stimulates thyrotropes in the anterior pituitary to secrete TSH. TSH is secreted into the general circulation, but goes to the thyroid gland and binds to cell surface receptors on thyroid follicular cells, leading to synthesis of thyroid hormone. The main thyroid hormone made by the thyroid gland is T4, but the thyroid gland makes a little bit of T3, and T3 is actually the active form that binds to the thyroid hormone receptor. So T4 and T3 do not just diffuse into cells. That's the way it used to be thought. We now know they get into cells via transmembrane transporters. And in many, not all, but in many of these cells, in these target cells, T4 can actually be converted to T3 by so-called deiodinase enzymes. And Dr. Bianco, who's the middle person on your screen as an expert, is one of the world's expert in understanding how these deiodinase enzymes work. Once T4 is converted into the active form of T3, it moves to the nucleus, binds to the thyroid hormone receptor in the nucleus, causes a conformational change in the receptor, leading to release of co-repressor proteins and recruitment of coactivator proteins, leading ultimately to an increase in gene transcription. I basically explain this for two reasons. First of all, I love this part of physiology. And second of all, many of these steps in this pathway have been identified as ways that can go wrong. And our group, particularly Drs. Refetov and Dumitrescu, have been at the forefront of identifying molecular defects leading to genetic thyroid disorders. In fact, some of these disorders are shown here. The first description of resistance to thyroid hormone was at the University of Chicago in 1967 by Dr. Refetov and others. And the actual molecular defect that caused this initial form of resistance to thyroid hormone was also identified here in the late 1980s by Drs. Refetov, Bella, and de Groot. This was basically identified that there were mutations in the thyroid hormone receptor beta gene that caused resistance to thyroid hormone. Since that time, Dr. Refetov has been involved in a variety of studies showing genetic thyroid problems, including mutations in the thyroid hormone binding proteins like TBG and albumin, mutations in the TSH receptor causing resistance to TSH, and mutations in a transcription factor called TTF1, which causes not only problems with thyroid gland development, but also neurological and pulmonary problems as well. Recently, Dr. Dumitrescu, who worked and trained with Dr. Refetov, identified defects in the thyroid hormone transporter protein, MCT8, and identified more recently mutations in SVP2, which is a protein involved in thyroid hormone metabolism, and patients with SVP2 mutations have a whole syndrome, and one part of it are thyroid hormone metabolism defects. I want to make sure it's clear that we don't only do genetics of endocrine disorders. We don't only do thyroid and diabetes. Just an example, I want to show some of the research that Dr. Tamara Vokes is doing on osteoporosis and metabolic bone disease. This has to do in particular, specifically with hypoparathyroidism. And the classic treatment for hypoparathyroidism is high doses of calcitriol and calcium. But Dr. Vokes was involved in the studies to show that recombinant human PTH can be used as a novel treatment for hypoparathyroidism. More recently, in the slide more to the right, she showed that patients receiving this therapy, at least a subset of these patients, can have a better quality of life than patients receiving the classic therapy. Now, I don't have time to go over everybody's research, but I just want to give you a flavor of some of the research here, which includes both basic and clinical type projects. These are just selected NIH research grants from faculty in the section of endocrinology on a variety of topics. And again, I don't have time to go into all of them, but you'll see that there's a wide variety of topics and a wide variety of interesting things that can be studied at the University of Chicago. But most importantly, all this ultimately comes back to the patients that we're caring for. This is a slide from the Kovler Monogenic Diabetes Family Forum. The Kovler Diabetes Center is a really important diabetes center at the University of Chicago. The director of the Kovler Diabetes Center is Dr. Lou Phillipson, and the Kovler Center does a lot of outreach to the community. They help with aspects of diabetes care in the clinic, and they are involved in significant research programs as well. But every few years, they get together their families, both the patients and their family members, together with the physicians, so that there can be a discussion about what are the newest findings in monogenic diabetes. And I just love seeing the picture of this slide with all these patients and their families, just to show the ultimate importance of this type of research. I'd like to move now on to the clinical programs we have in the section of endocrinology here at the University of Chicago. Clinical training in endocrinology is really a core mission of our fellowship program, and we have experts in all endocrine areas, including diabetes, thyroid disease, PCOS, osteoporosis, and others. We have people with special interests in what might be considered related disciplines, such as hypertension and pediatry. There are people who are seeing these issues directly in our clinic, and there are also special subjects as well that we have particular expertise in, including, as I mentioned, monogenic diabetes, genic thyroid disorders, and endocrine complications of novel chemotherapeutic agents. We have clinics in Hyde Park. Our main clinic is in Hyde Park. At our main campus, we also have a clinic downtown and a clinic in the suburbs as well. But again, the main clinic is in Hyde Park on the south side of Chicago. And this is just a slide of the primary service area of the University of Chicago Medical Center and where its boundaries are. It's a complex, underserved urban patient population, and it's great to take care of patients both within our primary service area and those patients that travel far and wide to come to the University of Chicago. This is just a long list of leadership of endocrine clinical programs at University of Chicago Medical Center. I already mentioned that Dr. Phillipson is the director of the Kovler Diabetes Center. Dr. Amir is the head of the Translation Research Center, which includes maybe more research rather than clinical stuff, but I thought it was important to include him here. Dr. Bakris is the director of our Hypertension Center. Dr. Bernane has developed a Chicago Weight, who's our obesity program, and Dr. Vokes is the head of our Osteoporosis Center. I guess I won't go through the whole list of names, but I did want to give a shout out and a thanks to the people who lead these groups. And we have a significant national visibility as well, including national leadership of major endocrine organizations. Dr. Phillipson was recently the president for Science and Medicine of the American Diabetes Association. Dr. Bianco is the past president of the American Thyroid Association, and Dr. Bakris is the past president of the American Society for Hypertension. And again, I want to come back as we're talking about clinical stuff to remind everybody that we're a combined adult and pediatric endocrinology group. The people on the top are people in the section who have primary appointments in the Department of Pediatrics, including Drs. Depluski, Yu, Greeley, Naylor, and Lemelman. I want to mention Dr. Yu is board certified in both adult and pediatric endocrinology, as is Dr. O'Sullivan down below, who has a primary appointment in the Department of Medicine. I'm including Dr. Phillipson on this slide, because even though he's an adult endocrinologist, he sees lots of patients with type 1 diabetes, including teenagers and adolescents. I like to move on towards the end of my discussion with education. This I'd like to show you the people that are leading our education efforts, and the people on the top run our various fellowship programs. As you know by now, Dr. Zaitnoglu is the director of our Adult Endocrinology Fellowship Program. Dr. Depluski, in the middle, is the director of our Pediatric Endocrinology Fellowship Program. And Dr. Bakris runs a specific hypertension fellowship as well. We have a T32 research training program. That's to help train our fellows in academic research. And the principal investigators on that grant currently are Graham Bell and Sam Refatoff. Raghu Ramira, who recently joined the section just this past year, this past academic year, is going to take one of the lead roles in this moving forward, however. I also want to mention Dr. Brady, shown here. He is the chair of the Committee on Molecular Metabolism and Nutrition. So what is the Committee on Molecular Metabolism and Nutrition? Well, PhD programs at the University of Chicago are not run within the departments. They're run by cross-departmental committees. And the committee that's, in a sense, most akin to endocrinology and where many of our faculty sit on is the Committee on Molecular Metabolism and Nutrition. And this is run by Dr. Matthew Brady, who's also a faculty member in our section. Dr. Brady also runs an undergraduate specialization in endocrinology. And this is actually one of the few institutions there is that you can actually, as a college student, have a specialization. If you're a biology major, you can actually have a specialization in endocrinology. And I actually love looking this. I show here is just a picture from the list of majors, minors, and other programs that the University of Chicago puts out. And you can see that endocrinology, S stands for specialization, but endocrinology is just below Egyptology on the list and just above molecular engineering on the list. So not that this really matters per se for an endocrinology fellow, but there are plenty of opportunities not only for you to learn endocrinology, but if you're interested, for you to teach, ranging from college students to medical students to medicine residents. So there are lots of opportunities here. So I'd like to thank everybody for listening to me. I'd like to just remind everyone that the fellowship program is truly a major focus and integral part of our section of endocrinology, diabetes, and metabolism. Our goal is to train leaders in both research and clinical endocrinology. And we look forward to meeting you, even if this year we're meeting you virtually. It's a pleasure to talk to you today. Thank you very much.